start with palpation. Now remember, what's the key to palpation?
Bony landmarks?
Find the big landmark, the big guy, all right? Because from the big guy, you can find the little guys. So what do you think the big guy is in the elbow area?
The medial epicondyle?
That's kind of little.
For real?
Yeah.
Oh, the olecranon?
The olecranon and the joint line itself, okay? Really lucky about the elbow joint and the knee joint, by the way, you actually have a joint line that you can actually see, right? Shoulder, not so much, because it has a lot of soft tissue, alrighty? You have a nice joint line here, so it's really easy to find that, okay? Alrighty, I'm gonna skip all the intro stuff right now, so you just get right into it, okay? Alrighty, so you find the joint line, okay? Sorry, my hands are cold today, okay? Alrighty, and what you want, and if you are having a little bit difficulty finding a joint line, because you can't have somebody that comes in with a lot of swelling in that area, ask them to bend a little bit. So, if you can't find it, can you bend a little bit? Alrighty, and it's right there, okay? Nice joint line, so, okay? Alright, so I know where it is now, okay? So from the joint line, alrighty, I'm gonna start more proximally, okay? So if I go from the joint line up and to the posterior aspect of it, relax, try to relax, okay? Alrighty, from the posterior aspect of it, I will be on the distal part of the humerus, okay? On the distal part of the humerus, I will have my epicondyles. You have your lateral one here, okay? And your medial one on this side, alrighty? Alright, and you wanna be more like on the posterior aspect, because what do I have over here?
Oh, vessels?
Well, besides that, what's all the way covering all the
Muscles?
stuff?
Tendons?
Muscles, all your muscles and soft tissue. So you're gonna be more on the posterior aspect, okay? Now, if I work my way up it, alrighty, can feel it actually sort of like an incline a little bit, and that's your supracondylar ridge before you get to the actual bone itself. Is that a little tender?
No.
No? Is it annoying you a little bit if I say, okay, all right, good. It's not bothering her yet. Remember, bony prominences have nerve endings, so it can be a little bit annoying to people, all right? So I'm back on the epicondyles, okay, lateral and medial, all righty? What I want to go ahead now, I'm going to stay on the lateral side, okay, all right? All right, I'm going to go down to the distal aspect. Okay, distal aspect of the joint line. And what bone should be there on the lateral side?
Radius.
The radius, okay? So I'm gonna look at, and I'm to make sure that I'm on the distal aspect because everything is so close together. Just bend a little bit, alrighty? And I'm gonna see, like it's just distal to her joint line where she's bending, alright? So at that point, I'm gonna say, I am sure I am definitely on the radius now. So if you go a little bit, yeah. And you could sort of measure, it's like a finger width from the epicondyle to pretty much where your radius will be, alrighty? Alrighty, so what's wrapped around your radius again? Radial head, pretty much. What's wrapped around there? Well, that's connecting it, okay? That's connecting, okay. That is connecting it, okay? So from your lateral epicondyle to your radial head,
pronator quadrator.
Okay, you'll have those muscles there, but you have your radial collateral ligament or your lateral collateral ligament, okay? Alrighty, so you know those are what your two connecting points. So you have your lateral collateral ligament or your radial collateral ligament connecting the lateral epicondyle to your radial head, alrighty? Alright, so what you're going to want to do, and sort of like, guys, best way to sort of make sure you're on it is to stretch it a little bit, alrighty? And it's most stressed, alrighty, when you are either in full flexion, the collateral ligaments, or extension, okay? So I'm going to keep it extended, alrighty? And what kind of direction of the force would it be I applying in? Which direction? If I want to look at my lateral collateral ligament?
Medial.
Medial. So I'm going to give a little stretch, and I'm going to just plop my fingers right in between the epicondyle area. And bend a little bit again. Okay. Yeah. And, okay. And I straighten. Okay. And I'm just going to plop. Ooh. sit still, if you can, try to, right? And I'm gonna feel, righty, a little, giving her a little force, okay? Right, towards a medial direction to try to get her lateral collateral become a little bit more taut, righty? Because when ligaments and soft tissues are taut, can you palpate them? Well, technically, yes, you can palpate them, but can you differentiate them? No, because everything's taut. Because same thing as if you think of muscles, we said resist the movement a little bit so you can make it pop out. When you're looking at palpating ligaments, okay, you want them in a stressed position, and you apply a little resistance to make it become more taut, so you can feel something stiffen up under your fingers a little bit, okay? And to do that, okay, right, I'm in, try, oh, don't hyperextend. Try not to. Do you guys see that?
Yeah, a little bit.
Yeah, she was hyperextend. She wanted to help, all right? Patients want to help. So what I'm gonna do, alrighty, I'm gonna apply a lateral force on the humeral area, a medial force on the forearm area, and I'm gonna stretch, and stress out a little bit to feel a collateral ligament coming out.